Welcome to Your Doctor Wants to Quit, a podcast inspired by the need to save healthcare in America. I am Dr. Joy, a board-certified emergency physician, and I created this podcast to shed light on the challenges our healthcare system is facing through the multiple lenses of doctors, other healthcare professionals, and patients. By listening and working together, I believe we can fix healthcare in America for all of us.
Nurses are the backbone of the hospital, and they are the eyes and the ears of the physician. And they're the ones that are responsible to notify the physician if something isn't right. And they're the ones that are often calling the code and recognizing if a patient has arrested. So the amount of responsibility that nurses carry, particularly in inpatient settings, is enormous. Physically, emotionally, it's exhausting.
You are hearing the voice of Zupancic Albin. Her career in healthcare spans 2 decades, beginning in the high-stakes hospital environment as a critical care nurse, and then years later finding her way to law school. In the blending of these two passions, the law and medicine, she has forged a path for herself as a healthcare attorney and advocate for providers and patients alike.
My name is Zupancic Albin. I am currently an attorney, although I have a background in nursing. My mom went to nursing school when I was in high school. She had 5 kids, and somehow this woman went to nursing school and got her bachelor's in nursing while raising 5 children. And my father worked full-time also as an attorney. So I don't know how she did it, but I started to think about the nursing profession as I was watching her navigate her nursing education. And then she worked part-time in the labor and delivery unit. And so I was able to shadow her one day. And I also really, really loved science. AP biology was my favorite class of all time. And I really enjoyed learning about the human body and about genetics. And so that's really where I kind of started thinking about going into healthcare and maybe seeking out a career in the healthcare profession. So I started my college career at University of Washington, and originally I was pre-med, but for some reason I thought that going to medical school would be too hard. And so I switched to nursing as if that was going to be much easier. It just, I think, was shorter. So then I transferred from University of Washington to Johns Hopkins University in Baltimore, Maryland, where I obtained my bachelor's of science in nursing. And then I worked as a nurse in the inpatient setting, primarily in critical care and cardiac nursing. So I was taking care of patients who just had open heart surgery or any sort of, intervention, stents, cardioversion, et cetera. So that was primarily the field that I worked in.
I recall from the many years I spent in hospital-based medicine, just how important the nurses were as members of the team and how much I relied on them to feed me the information that I would need to kind of steer the ship, so to speak. But they're the ones that are implementing all of that. And it can make or break the outcome for the patient, really. I mean, you guys are the first line of defense, and so appreciated. My nursing colleagues were some of the closest friendships that I formed when I worked in hospital-based medicine. There really is that sense of like being in the trenches together. And nurses are so collaborative in nature.
Yeah, absolutely. And working collaboratively is so important in the hospital setting because there's so many different roles and there's so many people that have to work together to get this patient from point A to point B and eventually out of the hospital, hopefully safely and on their way. Nurses are just a critical component of the patient's journey, and particularly in teaching hospitals, keeping residents sort of on track and pulling them aside and saying, "Are you sure you want to order that? Are you sure that's the right dose?"
Totally. Oh my gosh.
But I don't think that's what you wanted to order.
Yeah. I'm going to tell one story, and I don't know if I'm going to include this in the ultimate cut of this podcast.
Yeah, go for it. Yeah.
But I've had a few experiences being a patient, so on the other side of the divide, so to speak. And I can just remember showing up in labor, my water broke, just in excruciating pain. Like just the kind of pain that is so bad that you can't even think straight. You have no idea what's coming out of your mouth. You cannot focus on anything that's going on other than trying to survive that contraction.
Yes.
Which I know we both have kids. I'm sure you can relate.
Yes.
Anyway, I just remember the medical resident trying to ask me all of these intake questions. God. I was like, dude, it's in my chart. Like, I don't need you to ask me these questions right now.
Read the room.
But this beautiful angel of a nurse, I can still see her. Like, she's just imprinted in my mind forever. She just came up to me with this face of calm and just compassion. And she was like, it's going to be okay. And she's like, is it okay if I put my hands on your back? And I said, yeah. And she did this acupressure move where she just kind of like put her thumbs into my SI joints as I was having a contraction. And it literally lowered my pain about 50%.
Oh my gosh.
And I was crying because I was in so much pain. And she was like, it's okay. You know, just let it out. I mean, I will never forget this woman. I loved her so much.
Oh, man. She probably came in and was like, okay, to the resident, that's enough.
Yeah, like ushered him away.
Let me take over here. He's in the background going, okay, so family history. And you're like, get out of here.
Totally.
Yeah, the nurse was probably like, all right, we're going to do this later, okay?
Totally. Oh my goodness.
That's a great story. That's amazing. I love that.
Yeah. And I think it speaks to the ridiculous things that we're required to do from a documentation standpoint. For new doctors going through training, it's being ingrained in them how they're supposed to do their charting. But sometimes they didn't have the presence of mind, perhaps, to like put that aside in the moment. You know, like you said, read the room. We can maybe take care of that at a later time.
Yes. Well, and to be fair, I think intuition is a skill that you really develop over time as a provider. And I'm sure you can appreciate this, where, you know, over time you become so much better at reading the room and when's a good time to do something and when it's not a good time to do something. And also just developing a sense of, you know what, this just doesn't seem right. I don't like what I'm seeing. I don't like where this is going. And I think that as you become more experienced in you know, whatever field it is you're working in healthcare, really listening to your intuition is so important, because, you know, 99% of the time you're probably going to be right. Developing an intuition as you move along in your career becomes actually really important to listen to. And there were several times I remember in my career where I listened to my intuition and I was right. And it changed the outcome for patients significantly. So it's a skill you develop over time.
You're so right. It is so important. I work with a lot of trainees of different kinds, and there is a big difference between following what the textbook says and then putting that into real practice.
Yes.
We want to obviously apply a standard of care, and that's important too. But the practice of medicine is very nuanced, and you can't directly apply what you learn straight onto a human being, because human beings are all different and situations are all different. And we just have to cultivate that intuition, like you said, and be flexible and try to also use our critical thinking skills and think on our feet. I mean, these are things that you can't really teach. You kind of have to learn by doing or by observing other people who are strong in those areas do them. Yes. And it is not easy. But I think nurses in particular, because, as you said, spend so much time at the bedside, you're really there moment by moment. You have so many more opportunities to cultivate that intuition because you have so much more face time with the patient, which is such a valuable thing to the care team overall.
Absolutely. Yes, I would say never underestimate the power of intuition. And maybe what you're thinking is happening isn't actually the case, right? But at least if you have that little something that pops into your brain, like that you have a question, or you're like, this just doesn't seem right, ask questions, investigate. And maybe what you thought was going on is not actually the case. Great. At least you took the time to figure it out. This comes into play from a legal standpoint, right? So for nurses who are executing physician orders, there were times when you get an order from a physician and a nurse's job is to execute those orders. However, if they look at an order and they think to themselves, I'm not really sure if this is the right thing for the patient, or I'm not really sure if I should be doing this, taking those steps to make sure that this is appropriate for the patient is an obligation that nurses have. And I have had cases where, a nurse just sort of blindly followed an order and then had an issue, had a complaint filed with the board of nursing. And just saying, well, it's a doctor's order is not necessarily a defense. It's certainly meaningful that the physician ordered it, but the nurses are still responsible to make sure that that order is appropriate.
Yeah, it makes sense. But I can see how that can also be tricky because the hospital does function like a hierarchy to some extent. It's a team,
Right.
but it's also a hierarchical team.
Absolutely.
And it can be intimidating, and I can relate to that in a different way, having been a trainee as a resident and having an attending tell me to do something that I wasn't sure was the right thing. And it takes courage to speak up, but it's so important for patient safety.
Absolutely. Absolutely. And let me just emphasize that I think that people expect healthcare providers to be perfect, but healthcare providers are human and nobody's perfect, and they make mistakes. And, if we can look out for each other, then at the end of the day, that's what's best for the patient. But also, mistakes happen, errors happen. It's not something that you obviously want to happen. And you certainly don't want there to be a negative outcome for a patient, but mistakes happen, and it's all about what you learn from them and maybe how you change your practice moving forward. But doctors, nurses, whoever, they're not perfect. And I think they often expect themselves to be. I think people expect them to be perfect, but they're not. They're humans. They're doing the best that they can.
What you're getting at there, I think, is also another important point as it relates to burnout, because I think the personalities of people that go into medicine, whether doctors or nurses, I think all of us are perfectionists. We want the very best for our patients, and we really beat ourselves up if things don't go right.
Yes.
And part of the issue is you can do everything perfectly and things can still not go right. Some of it
Absolutely.
is just based on the particular disease or pathology that the person has, or, tragic accident or whatever it may be. We're there trying to fight for the patient's life, and we don't always win. And it can be so hard afterwards, going back through your mind, questioning, did I do everything I possibly could?
Yeah.
And we carry that with us. And I think that it's a little different than just witnessing something tragic, because you feel like you were there to intervene. And if you did your best to intervene and it didn't lead to saving the patient's life, it feels like this extra weight. Not only did we witness this tragic death, which is so sad, but we also feel like we failed in our ability to prevent it, even though it may not be anything that we did. It still is something that you carry with you, and over time those experiences accumulate, and I think can be really heavy.
Yeah. You go home with Did I do something wrong? Should I have done something differently? It's a tremendous amount of pressure. It's a tremendous amount of pressure. I never worked in ICU, but I worked in ICU step down units. And so I would often get patients that were, 2 days out from open heart surgery. It was extremely intense, particularly given the complexity of the patients and the vulnerability of the patients. There were a lot of days that I went to work and I just said, I just hope nobody dies today. I just want to make sure nobody dies today. I remember, people would say, oh, you work 3 days a week, 12-hour days, so you get 4 days off. That's so cool. And I'd say, well, yeah, but I spend at least 2 full days just recovering physically and emotionally. So it was a very rewarding career in many ways, but it was also extremely exhausting and overwhelming and a significant amount of pressure. And not to take away from the physicians or anybody else who's involved in a patient's care in the hospital, but nurses are the backbone of the hospital, and they are the eyes and the ears of the physician. And they're the ones that are next to the patient the entirety of that stay they have there. And they're the ones that are responsible to notify the physician if something isn't right, or if the patient needs something different than what their original plan of care is. And they're the ones that are often calling the code and recognizing if a patient has arrested. So the amount of responsibility that nurses carry, particularly in inpatient settings, is enormous. Physically, emotionally, it's exhausting. It's exhausting. Being a healthcare provider in general is exhausting, and it's a tremendous amount of responsibility and pressure.
Like many healthcare professionals, Amber experienced feelings of burnout that stemmed from repetitive exposure to high acuity cases and the high-stakes nature of working in critical care. As time went on, she worried about the impact it would have on her own health to continue functioning in this intense environment where life and death scenarios are the norm.
After about 6 years into it, I thought, there's just no way I can do this for the length of my career. There's just no way I can do this. This is way too much. But unexpectedly, I started to realize that there was this very intimate relationship between medicine and the law. And I didn't realize that until I was out and I was practicing, and that so much of what we do as providers is regulated by the state and the federal government. And so many of the providers are walking around and trying to do their job that is so highly regulated, but not understanding what those regulations are and how they work and how to function within those regulations. HIPAA, for example, is like a bad word in medicine, and everybody is freaked out about HIPAA. You're so confined by so many factors that really make it difficult for you to practice medicine. And these people don't even understand what it is you have to do every single day. And how is it that you can create rules and laws that tell them what to do and you have absolutely no idea what they actually do? That's crazy. So then, of course, I thought, well, I'll do something easier, like go to law school. Let me just go into a completely different, intense profession.
I'm glad you mentioned HIPAA because I think it's a really great example. The idea of HIPAA is that we are not supposed to talk about people's health care to those that are not directly involved in providing the care. There was always this tension between sharing information for patient safety and then being afraid to share information because of protecting patient privacy. And trying to strike the right balance. But then you have a scenario where a patient comes into the hospital, they may be unconscious, we don't know anything about them, we don't know their medications or anything like that. And yet, because of some of these HIPAA laws, previously it was very difficult to get medical records from other hospitals which would be
Yes.
required for us to do our job and to keep the patient safe. And there was this concept, which I think still exists, called breaking the glass. It's this idea of, we protect patient privacy to a point, but when patient privacy becomes secondary to patient safety, then we break the glass, and then we're able to get access to health records in a way that we normally would not without patient permission.
Yes.
But this tension was unresolved for a very long time. Nowadays, it's a lot different than it used to be even a decade ago. In our electronic health record, it connects to a health information exchange where we can see records from the different health systems for the patients that are part of our practice. But that was not normal 10 years ago.
I just remember thinking, I have this job to do, and it's regulated by people who don't even understand what we actually do. So who's advocating for us that actually have experience in medicine and have experience doing this job day in and day out? So I thought, well, I'm going to law school, and I'm going to be that person, and I'm going to be that advocate because I understand what providers do, and I understand the intricacies of medicine and that it is so nuanced. And just because somebody says something that, somebody did wrong, well, I can guarantee you there's about 30 things that happened before that time that really made a difference in the outcome of this patient. So I decided to go to law school, and I really pivoted my career, but still using my nursing experience and my profession just in a different way. And so now what I do is, you're the bridge with healthcare and patients, and I try to be the bridge between the law and providers, and really try and help my providers and my clients understand the laws that regulate them and help advocate for them when they are coming up against, either understanding those laws or being regulated by those laws or disciplined by those laws. I really enjoy what I do. Of course, there's a lot of stress, and people come to me in crisis a lot of times, but fortunately, as a former critical care nurse, I understand how to manage people in crisis. Getting into the legal field is not something that I ever anticipated. It just really sort of happened, and I know this sounds cliche, but it happened very organically. When I went to law school, I remember emailing my colleagues, my nursing colleagues, and saying, gosh, I'm stressed out, but at least I can do that sitting down. I don't ever want to live in regrets, because I think that every choice we make in life is meant for something. And maybe it wasn't the right choice at the time, but I think that if you recognize that, if you're in a situation that you're not happy in, whether it's your career or whatever, you can always pivot, you can always change. I tell people to this day, I'm like, if you see a nurse, just give them a hug and say thank you. Just thank you for your work, because you are heroes. I mean, absolute heroes. I think that nurses are often underappreciated and undervalued, and the load that they carry is tremendous.
Amber made the difficult choice to leave her profession as a nurse to pursue a career as an attorney. But as she took on this new challenge, she always kept her passion for nursing close to her heart. Amber's way of serving took on a new form, as an advocate for both patients and her colleagues in healthcare.
I went to law school in San Diego at California Western University, which is in downtown San Diego. And I chose that school because they had a very good health law program. And I was very interested in studying health law, particularly given my background. So I got my law degree, and I continued to do nursing during law school. And, by my third year in law school, I thought, okay, I have to start getting some legal experience. So I did an internship with the DOJ in San Diego in the Office of Medi-Cal Fraud and Elder Abuse, which is a really interesting experience there. Graduated from law school and became licensed as an attorney. And then my practice primarily for the entirety of my legal career has been in healthcare law. I originally started practicing medical malpractice. So I was doing mostly insurance defense, representing doctors, nurses in medical malpractice cases, and then did some consulting for risk management in for hospitals and health systems. And then I kind of transitioned more from the medical malpractice field to more compliance and regulatory representation in healthcare law, and worked for different law firms, and then decided to go out on my own about 9 years ago. So the bulk of my practice has been in compliance and regulatory and healthcare field. I represent nurses, doctors, physical therapists, anybody who works in the healthcare space. I represent them individually. I represent their practices. A lot of what I do is licensure defense. So if there is a board investigation, a complaint that's been filed with the board that regulates my client, whether it's the medical board, nursing board, whatever, I represent them in that investigation process. Most of the really sophisticated healthcare fraud schemes were perpetrated by non-physicians, non-providers. I would say an overarching theme of the healthcare regulatory and compliance world that I often advise my clients is to just be proactive, and if you have a sense that something is not right, do what you have to do to protect yourself and make sure that you don't get implicated in something that you had absolutely nothing to do with. But when honest mistakes happen or circumstances happen that are completely out of the control of the provider, it's really interesting how far an apology can go to a patient. At least in Oregon, they've codified an apology law, essentially, which basically says that if you apologize to a patient, that's not an admission of guilt, and that cannot be used against you in trial. So a lot of times, if a mistake happens, patients just want an apology. They just want an acknowledgement that this happened. We're really sorry. And here's what we're going to do to move forward. And I think physicians, providers are deathly afraid of making an apology or admitting faults because they're just so afraid of litigation. They're afraid that their license is going to be at stake. And I completely appreciate that. But I will say that one of the best ways, I think, to prevent lawsuits, to prevent a licensure complaint, is to develop rapport with your patients, acknowledge if something didn't go right, and this is what we're going to do to fix it. Developing good relationships with your patients is so crucial. They want to be seen, they want to be heard, they want to be acknowledged. And I know in your first podcast you talked a lot about health and then care, and how important care is in your role as physicians. And I couldn't emphasize that more. I strongly believe that providers who develop good relationships, I'm talking about when they come in, you listen to them, you work with them, you acknowledge if something wasn't working or a mistake was made or whatever, and then you work on a plan to move forward. I just can't emphasize that enough.
I think that what you're saying holds true, not just in a scenario when things don't go as planned, but just in general. I think that's what people want, even in the best of times when everything is going well. I've been thinking about this a lot lately with respect to the pressure that's on us to see more patients per hour because of reimbursement cuts and just not being able to make ends meet and cover overhead and all of this, that's happening. I feel like it's really that we're being robbed of the doctor-patient relationship.
Yeah.
And maybe I should correct that and say that doctor person relationship, or the person to person relationship, one of us happens to be in the role of the doctor and the other happens to be in the role of the patient.
Hmm.
I would argue that it's not just to the benefit of the person that's in the role of the patient. I think that as doctors, we went into this field because we want to care for people. We want to be of service to others. We want to have that connection, that trust, and be a guide or a helping hand to somebody who is in need. And
Hmm.
when we're forced to turn appointments over so quickly and spend a bunch of time in front of a computer checking boxes, it's a robbery. It's stealing
Hmm.
the piece of the practice of medicine that motivated us to go into this field in the first place.
Yeah.
And I think it's one of the biggest, maybe under-recognized contributors to burnout is the
Yes.
fact that we don't have the time and space to cultivate that relationship with the people that we're serving, which I
Yes.
think is so important for the provider's emotional well-being too, and sustainability of this very difficult job over years and years.
Hmm.
And I think some of my colleagues, because they've been put in situations where they have to practice this way, become callous. They kind of put up walls. I've seen people become jaded.
Hmm.
And then that is sort of a snowball effect, so to speak, in terms of how they're interacting with the people that come to see them.
Yeah.
And it's really sad. It's like tragic for me to watch it all unfold. And
Hmm.
it's one of the reasons I'm doing this podcast, because I want to give a voice to the people that are delivering health services so that they feel heard and that we
Yes.
can talk about the issues that affect all of us. They affect patients, they affect healthcare providers. All of us are impacted by what's happening in our healthcare system. And it's about preventing burnout, but it's also about quality of care.
Absolutely.
Because when you have people that are able to connect and really have an understanding, you're not going to miss things, right? You're going to be more
Yeah.
attentive. You're going to have more opportunity to use your intuition
Yeah.
and have better communication with the person that you're serving. But that's not possible when you have 10 minutes total to conduct a visit, and that includes
Yeah.
your charting time and placing orders and everything else. It's just not feasible.
Yeah.
No one can do that. Even speed dating is longer than 10 minutes, right? How can you possibly do that?
How can you possibly get to know somebody and then, serve them in the best capacity? How can they feel seen? How can they feel heard? They can't in 10 minutes. And I appreciate that so much about the position that you're in as physicians and as providers who are trying to take care of patients to the best of your ability, but are so limited by the constraints of the insurance industry, by the demand, by the complexity of these patients, and just not having the time that you really need to get to know somebody. And I think if you had more time, think about how much less services maybe patients would need, and less billing would happen to insurance, right? um, Working in the more of the preventative care model, which I know a lot of people have been screaming about for many, many years. We just don't do enough preventative care.
It's not covered by insurance. That's the problem,
Exactly.
right?
Exactly. Exactly. And I, as an attorney, one of the things that I do is help clinicians start their own practices. And I have had so many providers come to me and say, I am so tired of the insurance industry and dealing with them that I am completely cutting out insurance and I'm going to a full cash pay model. And I will super bill my patients. They will have to pay me up front and then they can get reimbursed by insurance. Um, because providers are just so done with insurance and having to operate under that model and getting their reimbursement rate cut. It's just not sustainable. And so then they decide, understandably, to go to a completely different model, which is the cash pay model that a lot of people can't afford. And so then what is it? Then you become sort of an elitist healthcare model where, okay, so now only people who can afford to get a good healthcare, that's what you get. And then other people get the other kind of model. Or some of my providers who, do continue to bill insurance and have decided to create a model within their practice where they spend 60 minutes or at least 30 minutes with every single patient. I'm dealing with a client right now who is being bombarded by the insurance company about her billing. And she is deathly afraid of clawbacks, which is a major issue for a lot of providers because the insurance company can come back and say, you know what, all of these claims that we paid, we actually don't think that we should have paid those because of X, Y, and Z. And so we're going to claw back, $50,000, $100,000 in claims. With this particular client, she has a practice where she treats primarily complex patients. And every single initial patient visit is at least 60 minutes. And then every follow-up visit is at least 30 minutes, and she bills accordingly. But she's constantly getting letters from the insurance company saying, your trending of billing is so different than everybody else. And so she's obviously very concerned that, now they're going to come back and start clawing back claims. Now she has to hire me, and then I have to communicate with the insurance company saying, no, the medical records support her billing practices. And she has a different model where she treats very complex patients that have multiple comorbidities. So it's kind of like damned if you do and damned if you don't. What are you going to do?
Yeah, no, it's so true. And we get the same advice from our billing specialists as well in terms of what we can and can't do to prevent raising any red flags with the insurance companies, because they have a way of systematically monitoring the type of codes that you're submitting. And if you are an outlier, they're going to investigate you, even if you're doing everything correct.
Yes.
And one of the things that really kind of irks me about that is at our practice, one of our strategies for providing better care is that we never say, oh, we don't have time to deal with that today. Some doctors, you'll go to the doctor, and if you came in for a sore throat, that's what you're there for, and that's what we're going to deal with today. And if you want to talk to me about your hypothyroidism, you're going to have to make a separate appointment.
Right.
So we just completely don't do that at all. We say, oh, okay, we're going to treat your sore throat. But if you have questions about anything else that's going on, we're going to make time and space for that, because you're a whole person, not just a sore throat. And that's really important to us. So even for people who are not dealing with a lot of complex health issues, they might have more than one health issue going on simultaneously. And it may warrant multiple different types of codes for that visit. And because of our practice style, it's like we get dinged for actually doing a better job, because in a regular practice, that person would come back for a discussion on their hypothyroidism, and that claim would get submitted anyway. But because there are two lesser codes, one for sore throat and one for hypothyroidism, billed as separate visits, it doesn't raise a red flag. Whereas if you start stacking complaints and issues and include them all in one visit, and it's potentially saving multiple visits down the line, you don't get rewarded for that. You get audited. It's
Correct.
Crazy.
And then you have to call your lawyer and pay your lawyer. You're freaking out, and it's just a vicious cycle, and something has to change. Otherwise, providers are just going to say, screw it. I'm just not going to deal with insurance at all and go to a cash pay model that only a select number of people can afford.
Yeah. And then we've made the decision at our practice to never go to a concierge model. I mean, we do have self-pay rates for people that don't have insurance or aren't in network, but that's meant to expand accessibility to the plans that we can't get contracts with. It's not meant to replace the primary model of how we get paid, which is insurance billing. And that's a very concerted effort that we have committed to very intentionally, because ethically we feel like all people deserve good care. And if you pay for insurance, we should be able to use that insurance to get you that good care.
Yeah.
I have so many people that ask me, oh, would you please just go concierge? People want that higher level of service. They want more access to us. And we're really just trying to walk that middle path, provide the best possible service, but still within a conventional model, because for us, it's about accessibility to high quality care for our community. That's our mission.
Yes. And thank God for you, because I worry that, providers are just going to get so burned out that they're just not going to want to deal with it anymore. And then we're going to have a major accessibility problem. And I think that's what patients really want. I think they want to have providers, A, that built in their insurance, but also B, look at them as a whole person and not just as a sore throat.
It's hard to make the business side of things work when you do it that way.
And it has to be profitable and it has to be sustainable. And how are we going to figure this out to make it sustainable and profitable so that you can continue to do this for a very long time? You're in the business of taking care of people. You're in the business of helping people, and going out on your own and, running your own clinic, that can be really tough for providers.
So many physicians have sold their practices. The complexity of running a healthcare practice has become increasingly difficult with the demands that are placed on us. And also, it's risky to start your own business. And a lot of physicians are risk averse. They trained for a decade to become expert in a certain area, and they don't want to take the risk of starting a practice on their own and then have it fall apart because the business side of it didn't work. So it's just easier to sign on with a large healthcare system and collect your paycheck and clock in and clock out. But then the flip side of that is you lose your autonomy to some extent. So it's difficult. I think physicians today face difficult choices when it comes to figuring out how do they want to set themselves up to practice. And I think it's getting worse. And so the landscape over the next 10 to 20 years is very uncertain. And again, we continue to deal with Medicare cuts in the face of rising inflation and increased cost of labor. And it's not looking great. Medicare really sets the standard for what reimbursement should be, and all the other insurance companies sort of adjust accordingly. And because in primary care, we really can only bill for consults and office visits, we don't get to bill for high value procedures because we're not specialists. We don't have a way of offsetting some of these areas where we're getting squeezed with the higher reimbursing procedures. And so it just becomes harder and harder to sustain the practice. The reimbursement model for primary care speaks to how the powers that be value primary care is they don't place value on primary care because they don't reimburse primary care what it's worth, and they don't provide enough resources for us to really be the medical home for people and prevent a lot of the things that add cost and waste into the system, like unnecessary rehospitalizations because the patient can't get what they need in the outpatient environment, so they end up bouncing back to the hospital.
It's a mess. Yeah. And, again, many of my clients have shifted to a full cash pay model, or they've just said, I'm not taking Medicare and I'm not taking Medicaid. I just wrote, essentially a notice for a client of mine to his patients that he's not taking Medicare anymore. I don't have the answers. I wish I had all the answers, but something's got to shift. And, hopefully you have the answers, Dr. Joy.
I'm seeking the answers. That's why I'm interviewing all of these wonderful people, such as yourself. I think that if we put our heads together, even if it's asynchronously, maybe we'll come up with the answers.
Maybe. At least we're trying. We're trying.
We're definitely trying. I think it's interesting to think of this in the context of what recently happened with Scripps and Anthem. Are you familiar with all of that? So Scripps...
remind me. Okay.
Yes. So in San Diego County, we have a few different health systems. We have Sharp, we have Scripps, we have UCSD, we have Kaiser. Those are probably the top four. And so recently, Scripps decided to drop Anthem as an insurance provider. So if you were going to Scripps and you were on Anthem insurance, all of a sudden you can't go to Scripps anymore because they're no longer a network. And it happened pretty abruptly without a lot of warning.
Yes.
I do believe they tried to make provisions for people who are, say, like in the middle of cancer treatments, chemotherapy. I mean, you can imagine something like that would be pretty devastating. But there were patients who had surgeries planned because all of this happened on January 1. And so patients had been seen in December, had planned for surgery first week of January, and all of a sudden their surgery's canceled because they're not in network anymore. Things like that were going on. So Scripps also just recently, 4 or 5 months later, made up with Anthem. And so they're back in network again, but nobody really knew if that was going to happen or not. The thing is, an organization like Scripps is huge. I mean, there were hundreds of thousands of patients that were affected.
Yeah.
And they're essentially boycotting Anthem to negotiate higher reimbursement rates. And Scripps can do that because...
Your Scripps.
Yeah, because if they stop taking Anthem, Anthem takes a hit. If my practice stops taking Anthem, Anthem doesn't care.
Big whoop.
So
yeah.
It's really unfair to the smaller practices. We have no negotiating power. And so we just have to accept whatever the reimbursement rates are, and they're not the same. My contract with Anthem, I'm sure, looks a lot different than the Scripps contract with Anthem. I can provide the exact same service to a patient with the exact same insurance plan and get paid less than what UCSD or Scripps is getting paid for that exact same service. So when you don't have parity in reimbursement, how can you compete? How can you have fair competition? And if you want to try to have more negotiating power, then you have to, as a small practice, align yourself with a large healthcare organization, which then effectively makes you part of that system and you lose your autonomy. So you're in a pickle. You're in a pickle is the nice way of saying it.
Yeah. Parity, I'm generally a fan of less government regulation, but I think in the context of healthcare, advocating for legislation that protects parity. And for example, in Oregon, they passed a parity law that nurse practitioners have to be reimbursed at the same rate as physicians. So, I think there's work to be done on the legislative level for sure that protects providers and ensures that you are being treated fairly and that there shouldn't be different reimbursement rates depending on how big your practice is, because you're just as important to your patients as the patients at Scripps. It should be equal. Whatever the CPT code is, it should be equal. So perhaps that can be taken up legislatively.
In Amber's career as a healthcare attorney, she has been a champion for both providers and patients disenfranchised by the system. As time went on, Amber began to realize the universality of these challenges, and even Amber's own family was not spared.
I did get permission from my sister to share this story. It just sort of highlighted to me how difficult it is from the patient and the provider side when it comes to getting certain diagnostics or whatever services approved by your insurance company. My sister was having numbness and tingling in her lower extremities and sort of come and go. And it was just really strange. She'd never experienced this before. And, she wound up seeing her primary care and then being referred to a neurologist who ordered an MRI. So she had the MRI, and on the MRI, the radiologist noted a lesion on her C-spine. And the radiologist clearly said in his report that this lesion needs to be investigated further in another MRI with contrast. And so the neurologist ordered the MRI with contrast to further investigate this lesion on her spine, and insurance denied it. And so she came to me and was like, I don't understand why this is being denied. And I said, I don't understand either. Go back to your physician and try and figure this out. Well, she went back to her doctor's office, and her doctor essentially said, we've called insurance. There's nothing more we can do. And of course, initially I was a little miffed with the provider because I said that, of course, there's something you can do. This is so obvious. The radiologist clearly says on the report that this lesion needs to be looked into with contrast. The insurance company had said that the order was unnecessary and that she needed to go to physical therapy or have steroid injections. And I'm going, what? This doesn't make any sense. How would physical therapy help her? And I certainly don't think that she should be getting steroid injections in a suspicious lesion. This doesn't make any sense.
So, yeah, because something like that could be a tumor, it could be MS. There's a lot of different things it could be. It could be an infarct. I mean, I haven't seen the report, obviously, but I mean, the things that it could be are things that are not like, oh, I have a herniated disc and I need to go to physical therapy.
Yes.
It's potentially something a lot more serious than that.
Exactly. And MS was a differential diagnosis on the radiologist report. We happen to have MS in our family. And so my sister was just kind of pulling her hair out and saying, I know I need this imaging, but my doctor's saying they can't do anything. And now I don't know what to do. And so, fortunately for her, her sister is a healthcare lawyer, and this is literally what I do for a living. And so I then said, all right, we're going to get to the bottom of this. I requested her medical records. I looked at her records. I got the radiology report. I wrote an appeal to the insurance company.
Which, by the way, for those that don't know, so the process is your doctor can appeal it for you. And if the doctor's appeal is denied, you as a patient can appeal it yourself. You get a second chance at an appeal.
Absolutely. And they should give you those steps in the denial letter from the insurance company. You know, if you disagree with this, this is the route that you can appeal. And so essentially, that's what I did on her behalf. And it was so obvious that the insurance company had completely missed the radiologist's findings. And the insurance company was saying that she had complained of neck pain. And so that's why they recommended physical therapy and steroid injections. And I'm looking through her medical records and I'm saying, nowhere in her medical records does it say that she complained of neck pain. In fact, she denied complaining of neck pain. And it is so clear from her records what her history is. I don't even know where you guys got this from. So I appealed it on her behalf. And sure enough, they said, oops, sorry about that. And they approved it. But how many patients are in this position where they just have absolutely no idea what to do? They don't know that you can request your medical record. Even if they do request it, they don't know how to read it. They don't know how to advocate for themselves. And how many of them just say, all right, forget it. I'll just go get PT. I'll get steroid injections for absolutely no reason. So that's my story that hit my family personally.
I'm so glad that your sister was able to get what she needed and that you were able to help her, which is amazing. But most people just have their doctor's office advocating for them. The doctor's office is the only one that can really do that work, you know, interpret the results and use the medical terminology and understand what's going on enough to fight for what the patient needs in this kind of peer-to-peer scenario.
It's a real problem. And I appreciate and understand how much time the providers spend dealing with this stuff that is totally uncompensated for. And, you know, and then the patient is sitting here going, well, what's happening? And why can't I get this test that my doctor is saying that I need? And then how many people are just saying, well, screw it. And then they don't get the test or don't get the care that they need. And, you know, oh, whoops, we could have diagnosed your MS 5 years ago.
And it's so illogical because that's bad for patient care and it's also bad for the healthcare system. If you think about it, the patient's going to end up with a worse outcome because of a delay in diagnosis. And it's going to cost the healthcare system more to care for that patient because we didn't pick it up early enough to intervene without it being more complicated.
Absolutely.
You'd think someone would figure this out.
One thing I was thinking of was, you know, how can we improve the system or what changes can we make? I think one change that seems sort of out of the box, but maybe starting early in life and educating people about the healthcare system, about insurance, about how to advocate for yourself. I think we need to start integrating some of these life situations and life skills in school. Why aren't we teaching kids about insurance? Like, what is a deductible? What does some of this stuff mean? Because eventually they're going to be on their own and they're going to be dealing with insurance and have no idea what to do and how to handle some of these situations. So maybe this is something, we should start teaching our kids early on in life. Like, what is this? What is healthcare? What is insurance? Everybody uses healthcare, needs healthcare.
Yeah.
Let's start teaching our youth about it. And maybe the more people are educated about it, the more they're able to advocate themselves and, better their own outcomes because they just know how the system works a little bit better. They know how to advocate for themselves. I don't know. That seems like a wild idea, teaching kids life skills.
I think it's a really great point. I think it's sad that we have to think about that because it's sort of like almost like giving them the skills to navigate the wild jungle of the healthcare system,
Yeah.
even as adults, if you don't work in the field, it's hard to even understand how to navigate. People that come to see us at our practice, they don't know the difference between like if they have an HMO plan or a PPO plan or what a copay is versus a co-insurance. I mean, it is so overly complex. And then every single insurance plan is so different in what the patient's part of their responsibility is versus like what actually gets paid out. And then there's frustration involved because then people get a bill they weren't expecting, but it's sometimes because they didn't really understand the type of plan that they signed up for because it's hard to understand. I mean, a normal person doesn't understand that stuff. How could you?
Yes.
No one taught you about it. And so, you're just going onto a website, picking, some type of healthcare market insurance plan, just trying to find the cheapest one because it's already so expensive, but you don't really know what the implications are further down the line of the plan that you chose and what that means in terms of who you're going to be able to see for your care, how much it's going to actually cost you out of pocket beyond just your monthly rate that you have to pay. Yeah, so I think it's totally valid. We should teach kids about this. And I also hope that simultaneously we can make the healthcare system better so it's not this crazy, horrible thing to navigate. But I mean, we have health class already. We're teaching kids about health. Why don't we talk about health insurance?
Health insurance. Just teaching the basics, I think would probably go a really long way. I mean, I obviously try to teach my kids some of these things because this is just sort of the area that I work in. But yeah, we're in health class. How about we, start teaching them about something super major like health insurance that they're going to have to deal with.
Yeah.
Everybody's going to have to deal with at some point.
Yeah. Well, and also too, I think that there's a perverse incentive for the healthcare industry to keep people in the dark because people don't know how to advocate for themselves. It's this nebulous black box that is hard to understand or penetrate. And so if you don't understand it, then you can't affect change. You can't do anything about it. You don't even know what to fight for or like how to articulate what the root cause is. So if we all are able to become more familiar with the language of healthcare from like a policy standpoint, and as it relates to health insurance, and we all as a society have a better understanding of how that all works, if we can empower people with information so that they even understand why they are frustrated, like your sister, she couldn't understand how this could possibly happen. But if we break it down and make it easy to understand and more people are knowledgeable, then we can band together and it's easier to fight for what's right. How do you fight for something that you don't understand?
Absolutely. And again, these are, my sister is highly educated. She's is very successful in her career, but this is literally Latin to her and to most people, and they just don't understand. And so most people just give up and don't get the treatment they need.
Thankfully, Amber was able to get her sister's appeal resolved quickly. But most of Amber's cases are far more complex, as she represents healthcare providers facing regulatory issues that do not have an easy path to resolution. I asked Amber to share with me how she stays grounded in the face of the multifaceted problems she must navigate for her clients.
My biggest mentor would probably be my dad, who is an attorney. He works extremely hard. He is so objective and is such a good resource for me when I'm feeling overwhelmed or I'm really struggling with a case. Lawyers are generally emotionless, and that's basically how we've been trained. And I often joke I have sort of a cold, dead black heart. But some of us do feel things, and I do feel things, and I get very passionate about many of my cases, and particularly when I feel like one of my clients is being treated unfairly. And he's an incredible sounding board for me when I am experiencing frustration, and helps me brainstorm and helps sort of bring me back down to earth. But much of what I do is in opposition to the government. And it's truly a like David and Goliath situation. And I am a solo practitioner, and I'm not a member of a giant law firm with enormous resources. So it's me against the government many times. And so I would say my dad is very much a mentor to me and helps me out tremendously, and has helped me out in my career. Big ups to Jim Zupancic. Love that guy.
Well loved by many.
Yes, he is.
As our conversation came to a close, I asked Amber if there was anything else she wanted to share with us that stems from her perspective as both lawyer and nurse.
Just know that your doctors and your nurses and your providers, they're just doing their best, and they care about you, and they want to make sure that you're well, but it's a really hard job, and there's a lot that goes on behind the scenes.
I think that's really meaningful coming from you in your position as a healthcare attorney, because you see the full spectrum of things that go wrong. And for you to still be able to stand up and say the majority of healthcare providers are just struggling to do their very best for patients in what is an imperfect system, even though it may not always translate or it may not always come across that way, that is really the case and the heart of how we try to function every day.
Yeah.
And it's not easy. So
Absolutely. Absolutely. At the same time, advocacy is so important. And if you feel like something is wrong and your doctor just isn't listening to you or isn't understanding the issue that you're trying to communicate to them, sometimes you need to go to another provider, and they might hear it differently. And that's okay, because again, you could take the same case to two lawyers or two doctors, and they might see it completely differently. So for patients, advocacy for yourself is so important. And that can be as simple as, if you feel like something is wrong and you really just aren't accepting the answers that you're being given by your doctor or your provider, you can always go and see somebody else. And maybe they'll give you the same opinion, and maybe they'll give you a different opinion. But if you feel something, just really advocate for yourself and get another opinion. And that's okay.
I think that is so true and such an important reminder. And what I would say, speaking from the perspective of a physician, is that most physicians are totally okay with their patients getting second opinions. It would be expected or normal that the patient would seek a second opinion, especially for something that is unresolved or complex. I think a lot of patients are afraid to admit to their doctor that they're going to go talk to somebody else and get another opinion.
Yeah.
But somebody who's really good at what they do is going to encourage you to do that. One person does not always have all the answers. Sometimes the best outcomes and the best care comes from smart people putting their heads together and leveraging each other's strengths. And so a second opinion is not an insult to your doctor. It's really just getting more information to help with decision making and to help figure things out. And so if your doctor's offended by you wanting a second opinion, I think that's a red flag. Yeah. Amber's journey from nursing to practicing healthcare law has been one of purpose, grit, and following her intuition. After 20 years working in healthcare, Despite all its challenges, I needed to know what has kept Amber inspired to keep going.
My clients keep me inspired. I have clients who are starting their own practices, starting their own businesses, and really being entrepreneurs and maybe breaking away from sort of the traditional mold of practicing medicine or, going to work for a big healthcare system and really want to do it on their own. And that is super exciting for me to help them through that process and help them establish their practice and do something that's more cutting edge, things that are really making a difference for patients. It's nice for me to be a continued resource for them and for them to know that if anything comes up, I'm just a phone call away or an email away, and to continue to be involved in their practice as they grow and evolve and help them get through difficult situations. It's lovely to maintain that relationship with them as they grow.
It's inspiring to me to hear about the work that you do, supporting these doctors that are entrepreneurial, that are trying to do things differently, trying to add to the healthcare ecosystem in a way that gives people choice and options. This idea that you mentioned earlier, that sometimes it's just you against the government, this like David and Goliath kind of scenario,
Yeah.
it takes a lot of courage to take that on and to advocate for healthcare providers that are trying to do the right thing in a system that may not understand or make space for the things that they're doing or misunderstand them, like the example that we talked about with the healthcare billing. So thank you for doing your
Yeah.
in building a better healthcare system for all of us.
We're all just doing our best out here, We're all just doing our best.
Thank you for listening to Your Doctor Wants to Quit. I'm Dr. Joy, a board-certified emergency physician, and I created this podcast because I'm on a quest to fix healthcare in America through conversation. If you liked what you heard today, please follow this podcast or find me on Instagram at drjoymd. That's DOCTOR Joy MD.